right, cool. So now let's get into now I want to talk a little bit more about strongman, more implements and your idea on how they are used or can be used. So I guess just a general to start off, do you use any type of strongman? And this carries overhead pressing, obviously grip strength is a big thing. So just talk about that. What type of implements do you use with your clients and whatnot?
Yeah, I think the best thing about, strongman is it's such a vague term, and really can be used, and and the sport itself is just scalable to everybody.
Yeah.
So for me in my setting, we regularly use different strongman movements such as like farmers carries, suitcase carries. We have some sandbags. We have, I've done yoke walks with people.
Oh, really?
Uh, yeah, in order to teach proper core bracing. I think especially in our world, we know the core is a 360-degree muscle. The general population looks at the core as your abs, and that's it. And being able to put somebody under some load so they can feel tension through their spine, you get great glute activation. You can see great core activation. It really does help stabilize the core through a bunch of different movements. And being able to use that, it also makes rehab fun. Loading somebody up with a farmer's carry and be like, all right, pull those shoulder blades down and back, get into a nice position, make sure, we're doing nice diaphragmatic breathing, keeping that core tight the entire time. Don't let the shoulders round, giving them all these cues. It kind of makes it a game for them. And after you do it a couple of times, they start picking up how to do it properly, but they also start realizing when they do it incorrectly.
Yeah.
And that's a really cool moment, because when you see somebody going through something, you can see them working it through in their head. And then you see some lateral flexion off to one side when they take a step. They're like, no, that wasn't right. And that makes my job easier, because they're like, all right, they're learning their body, they're learning how to position, they're learning how to brace properly. And especially, when we're talking specifically low back injuries, core bracing is kind of the fundamental base of what we do when, rehabbing, whether it's a facet or a disc or anything like that. So there really is a great learning curve when you bring strongman implements into the rehab setting.
So yeah, so I was going to assume that pretty much well, one, I assume that you did use it. Two, I assume like carries, in my understanding, it seems like things like loaded carries are probably have the kind of the best transfer to rehabilitation. Was it your idea, or how did you just say, hey, I know this works, so I'm going to do it? Or was there guidance before you? Or what's kind of how much is that used within in the world of athletic training and rehab?
I don't think it's used often enough. I think there are some people that are doing it really, really well. So when I was a senior in college, we had to do a symposium, like a senior thesis, and I wanted to do it on the prevalence and treatment of low back injuries in professional strongman athletes. And it seemed like a really fun topic to do until I realized at that point in 2013, there was one research article, I
Yeah,
think.
there was
Uh,
yeah, there was one guy, I forget when it was published. It was the shear force on the lower back for different.
yes, yes. So that was Dr. Stu McGill.
Oh, that
Uh,
guy.
yeah, so Stu McGill, he was literally the only person that had a peer-reviewed article that was out that included strongman implements in the rehab setting. Um, and he's kind of exploded in the past few years. And now he's known as kind of like he's the back guy. Anytime anybody has, especially in the world of strength sports, um, if you have a back injury, that's who you're going to see. And he
Right.
has, some amazing resources out there now. But so back in 2013, I was like, okay, great. I just based this entire research project off of a sport that literally has no research on it.
Go with my feelings on
Um,
this.
so I was ballsy, And I just reached out and was like, hey, let's get on the phone and talk a little bit to Stu McGill. And he was fantastic. We were on the phone for probably an hour and a half just talking through physiologically why strongman implements have such a great place in the rehab setting. And it's in the title of that article where it's doing loaded carries reduces the shearing force on the discs in the spine because it does teach proper core bracing. And when you're able to stabilize the lumbar spine in a way where you don't get any of that shearing force throughout it, you're just going to reduce your chance at, potential disc injuries down the road. And then it's also transferable skills for strength athletes to learn how to properly brace when in the gym. So when you're doing a box squat, which is something that you're unloading at the bottom, but trying to keep that core tension, we see a lot of guys in strength sports that can get injured during a box squat because they get lazy on the box. And, by teaching proper core bracing and getting, making sure that we're stabilizing the right areas, it makes everything a lot safer. And that's what I think is so cool about strongman, because you look at guys, lifting Atlas stones in this super rounded flex position throughout the spine, T-spine's flexed, lumbar spine is flexed but stable. It's really cool to see that, we're able to stabilize and keep core control in what seem like unsafe positions.
Yeah, I think probably everyone's had that conversation. Like when I first started, I'm like, how, deadlifts, like you're doing it completely wrong. Right? You're in catback city. But yeah, it seems I was reading some paper, and they were even talking about some dudes. When I deadlift, I kind of have a natural, my shoulders come over a little bit rounded, and from what I was reading, there's like a bunch of elite lifters lifting way more than myself, and who was I forget who it was, but they're basically saying the thing with when you're deadlifting, it's stability. That you don't want to have a U shape when you're turn spinning, because when you're U shaped, then it has to flex. It has to extend with that whatever. But if it's stable, with the Atlas stone, you're holding it, but you're stable, and so then you get up in your lap and so on and so forth.
Yeah, and I think especially in terms of the deadlift, we look at levers, and I think what we're seeing is like when in terms of conventional deadlifters, a round back deadlift is actually a little bit more efficient than being completely upright. Whereas with a sumo deadlift, having that upright torso is much more, attainable and helps performance a lot better because it changes the levers in the pattern of the movement. So it's really interesting to see the progression of the lifts and the sport throughout the years, and us realizing what is actually a safe position.
Yeah. So do your clients, or do they respond well to your training, to the strongman training?
Yeah, I think it's because a lot of people, when they have to go to some kind of therapy, whether it's physical therapy or coming to a sports rehab clinic, they have it in their head what it's going to be. And I think there are a lot of amazing physical therapists out there and a lot of great rehab specialists that, depending on the setting, some people are seeing 3 to 4 patients an hour. Whereas, where I work, I'm fortunate where I only see one patient every half an hour. So I'm one-on-one with every patient that I work with, and implementing, moving events and getting them off of a table and not just doing isolation exercises. It makes rehab exciting for them. And then they also can see objective increases in their strength, right? So doing a farmer's carry with 20-pound dumbbells is really cool. And you can feel your core working and not having to laterally flex and keeping, your hips and core tight. And then all of a sudden in 2-3 weeks, now they're doing 35 or 40 pounds a hand. And they're like, oh, okay, like I'm getting stronger and this is getting easier. So being able to like throw those objective measures into rehab just makes it so much more fun, and it gets the patients invested in their rehab more as well.
Yeah. Because obviously strongman is I don't know the word functional, but it's you're picking stuff up and carrying it. And that was this is more your field, rehab, but you hear rehab like, oh, functional training. And I just, that's why I want to reach out to you and talk to you. Is to my head, it's like, well, if you want to improve someone's stability walking or whatever, like do some carries and have them actually walk, right? Or if, for example, or let's say maybe their legs, they don't have full range of motion, but you can still load it with, say, yoke, and they can walk without doing, say, maybe 90-degree flexion. And that was, so why do you, to me as an outsider, it kind of makes sense. From what you're saying, it kind of makes sense. So why don't you think it's used more?
I think I think it's a few things. I think it looks intimidating. So people stray away from it. I think it's also strongman isn't that well known. I mean, within the strongman circle, it makes sense. And all of us are like, yeah, do a yoke walk, load them up. That sounds great. But when you're looking at a yoke, when you've never seen a yoke, you're like, what the fuck is that thing? And so I think there's a level of intimidation and lack of knowledge that kind of pushes us in that direction where since strongman is not mainstream and not that well known, I think, if you talk to anybody on the street, they're like, if you say, oh, like, yeah, do you know what strongman is? They're like, oh yeah, the guys that pull stuff with their teeth. I'm like, no, that's not it. So I think there's like a lack of general population education when it comes to the sport. Therefore, they don't know what the implements look like and they don't know how they were going to work. But that being the case, when you take that person that doesn't know anything, I think in rehab there, for some patients, they just need to be put under a little bit of load to actually know how their body is going to move. I think it's like, okay, you can have somebody walk back and forth and do a gait assessment, but if they're not loaded, they're not going to know how to brace their core because they're just kind of going through their everyday stroll. If you throw some weight on their back or throw some weight in their hands, it becomes completely different. And now they have to know how to activate. Okay, now I can't lean side to side when I'm walking. So where do I have to brace and where do I have to activate those muscles in order to move efficiently? And I think, by doing strongman movements in that setting, it just makes so much sense because that's what we do on a daily basis.
Yeah, I was going to ask you about that pertaining to basically carries. A big, huge, a common injury is caused by weak gluteus medius, knees collapsing, Trendelenburg gait. How do you say it?
Trendelenburg,
I wrote a paper on it, but I don't know how to say it. But yeah, it seems farmer carries, you're walking, you load, because when I first did farmer carries, like you really feel that force being distributed from foot to foot. I would probably guess there's no strongman that has Trendelenburg gait because they have.
I would hope not.
If they're doing walks.
If they do have it, they might not be a good strongman.
Yeah. Explain what Trendelenburg gait is. So that
so Trendelenburg gait is essentially when walking, we see one of the hips drop when we are loaded onto the opposite leg. So if we're standing on our left leg, we're going to see our right hip drop a little bit lower than our left hip because of weakness of the left gluteus medius. And it's a super simple test to see, literally you just have a patient, standing, have them stand on one leg. If their hips drop like this, we know the weight bearing leg has the weak glute med. And, as you mentioned, in strongman athletes, we shouldn't see that. And I think all too often, especially in general population, people don't know how to use their glutes. Glutes are these massive, big, powerful muscles, but the low back and the hamstrings like to kick in and take over for them. Which is why we see a lot of people that are older, it looks like they just have been laying on a piece of plywood their entire life because they just got no ass. And it's really important to be able to get that glute activation to, it's almost like this snowball effect where if we get proper glute activation, we then get proper core bracing, which then makes us move more efficiently. And a lot of the times with patients, especially with low back injuries, I have to regress them just to doing like prone glute activation and teaching them how to utilize their glutes before engaging their low back and their hamstrings. And once you do that, you kind of increase pretty quickly and you see a nice steady increase of strength and mobility and movement when you're just able to get the glutes firing properly.
Yeah, when I pretty much everyone I think is that when I started doing strongman, and I had done your regular deadlifts and squats and all that good stuff, but it took strongman for me to really get true what I feel would be like true muscle connection. Like I really felt my muscles moving because you're actually walking around and doing all that good stuff. So and then let's talk about the back, you know, because strongmen are known for just having massive backs, right? And that's obviously for posture, that another common, just in the general pop, not even say rehab, but I have tons of clients who are like bad posture, so on and forth, rounded backs, as they do some pulling. But with strongman, we just have massive backs. You're always pulling stuff or holding stuff. Talk about that for a little bit. Do you feel that just that excess, because maybe you're basic, you know, gym bros, they want the, you know, chest day Monday, right? And so they in the back, I think there's been a bit of a change. There's been more like in the back, you need to focus on the back. But talk about the use of the back in strongman and how that can help improve, you know, your scapular musculature, improve posture, and how that I was doing a paper on how they found that even like something like the tennis elbow, what they did is it was a case study, but all they did is they trained the traps and proper scapula position, and then all of a sudden the tendinopathy just went away. So talk about that for a little bit.
Yeah, you know, so I think there's two camps, I think, when it comes to, you know, posture and shoulder position. You know, I think typically what we've seen is everybody if we see like a rounded shoulder posture, we automatically make the assumption that pecs are tight, back is underdeveloped. That's where we have to start. So we see that 2-to-1 push-pull. And I believe it was Mike Boyle who was saying there also could be the opposite issue that we see in some strength athletes, where it's overdevelopment of the posterior chain, underdevelopment of the anterior chain. And essentially what that was going to do was having an overdeveloped upper back was going to push those shoulders rounded, causing you into this, you know, anteriorly rotated posture. You know, so I think it obviously is dependent on the population who you're working with. But in regards to, you know, how important the back is, I mean, virtually everything we do in strongman loads the posterior chain in some way. And having a strong upper back is obviously monumental for deadlifting. It's huge for Atlas stones. It is huge for farmers walks and carries. But a lot of people also don't realize it plays such a massive role in pressing, right? So when getting a log onto your chest, and you need to keep this elbows up posture, you know, your lats are doing a lot of the work. Your upper back is stabilizing that log in the position. And in order to dip with a 12-inch diameter log on your chest, you have to have a ton of upper back strength and stability through that T-spine in order to make sure that that weight doesn't pull you forward. And I think, you know, when I see a lot of amateurs competing, they do that initial dip and they start falling forward. So instead of strengthening their back, what they do is they try to dip even further. And, you know, that's when you see like the quarter squat or half squat dip into an overhead press, which is completely against what you need to do. And it's going to make the lift a lot harder. And moving a little bit further into that, you know, looking at, you know, scapular positioning and how important it is. I think, we talk, you mentioned the traps being so important. I think people forget that we have 3 parts to the trap, right? Like we have the upper, middle, and lower trap. And, upper trap, I think, is never going to be an issue for anybody who doesn't like shrugs. And, but training that mid and lower trap becomes really difficult because we don't want to have that winging of the scapula of the inferior border of the scapula. We want to make sure we can control our scapulas properly in our movements. And then that also plays a role into joint centration of the shoulder, which kind of plays into what you were saying about that tennis elbow. So if we're able to strengthen mid and lower trap, get that scapula pulled back a bit, making sure that we're getting the proper scapular movement of that little bit of abduction and then rotation. um if that humerus gets to sit in that glenoid nice and centered, distally from there, everything is going to start working more effectively. So I think that's why that study was so great, because it just goes to show, like, okay, yeah, like you can have tennis elbow and that's going to be killing you, but what is the cause of that? Was there trauma to the elbow? Is there overuse in that area? And if the answer is no, then you have to look up the chain to see what's going on with the shoulder. There's a chance we'll probably see subscap super tight, rotator cuff's probably going to be underdeveloped. Delt and trap are going to be taking over for shoulder movement. So really regressing everything back. And a lot of people think it might be counterintuitive to train the shoulder when thinking about tennis elbow. But, when we look at the kinetic chain, if you will, it all makes sense.
Yeah. And I think that's why I think strongman implements are promising, because it's kind of hard to have, well, correct me if I'm wrong, or if maybe I'm mistaken, but it's be kind of hard to have like a ton of muscular imbalances as compared to like regular population, because you're just always using everything at once. Like you're carrying stuff and everything's being used.
Yeah. I mean, the sport is brutal, right? Like, I can still remember one of my first strongman workouts, right? Like I thought I trained hard. I'm like, yeah, I squat and I deadlift and I bench and, I have a pity overhead press, but like, it's whatever. And then I like do my first strongman session with like farmers and yokes and carries. And like, I felt like got hit by a bus for like 3 days after. I'm like, oh, like this is what it feels like. um, and it is really because like when you're doing a yoke walk, it's like, I think like the best question I was ever asked is like, what muscle gets used during the yoke walk? And I just said, yes.
Jokes are brutal,
Everything,
man.
right? It's from the intrinsics of the foot all the way up to the C-spine, something is on at that point. And if it's not, you're not doing it right. And I think that's what's so beautiful about incorporating strongman implements into the rehab setting, because people get to feel their body in ways that they never thought before. I mentioned it before, like you can have somebody walking around, and they'll be pain-free, and that's great. Um, but we'll see the postural, deviations in every single step. But until you get some load onto them and they feel some weight, it makes them a little bit more aware of what their body is doing.
Yeah, I guess I should rephrase that. It might have muscular imbalances, but strongman is definitely going to show it if you have it.
Yes. Yeah.
And you're going to force you to fix it.
Yeah, and I think that's the beautiful thing about the sport, because you can't hide your weaknesses.
Yeah. It's definitely going to show. Yeah, real quick, how much longer do you have?
We got about like 10 minutes.
Okay, cool. So again, you had kind of mentioned this earlier. Well, I guess back up real quick. I think one of the hard things about making a definite answer is because there's no studies. We kind of like know you with your knowledge, what's probably going on, but it's kind of hard to say this is definitely what's going on. So anyway, so I want to talk about adherence. You had kind of mentioned this a little bit a while ago, but obviously in a rehab setting, adherence is obviously a huge aspect, right? It's not going to work if you don't do it. And you had kind of mentioned how strongman is fun and all this stuff. Do you think that could play a role in helping people continue their rehab? Let's say you do you have like a Rob Kearney's rehab camp, and you have like a month, and you go there and you do like sled pulls and yokes and all that good stuff.
Yeah, I mean, I think about it in the most basic way possible, right? So we take two patients. treat them at the exact same time that have the same exact injury. So say one patient, we have them supine on a table, we're teaching them diaphragmatic breathing, and then we go into some glute bridges, and then we do some four-way hip and core strengthening, and that takes us 30-minute treatment time, just going through all the cues and stuff like that. Same patient, same injury, but we're doing farmers and yoke walks and doing some sled drags and maybe a sandbag pick, or how about, or even something as simple as like a raised kettlebell deadlift or a functional lunge. I would imagine the patient that's just laying on the table the entire time is feeling, one, like they're getting treated differently for the same injury. And they probably feel like they're getting gypped a little bit because they're like, well, if that person can do that, why am I not doing it? So I think it also, along with just being more exciting and more fun and more interactive, I think, like I said at the beginning of this call, like it gives you more, objective measures to progress a patient, because if you want to keep somebody motivated, showing them week to week that they are getting stronger is the best way to do it. Regardless if you're a strength athlete or not, you're gonna like seeing that you're lifting more weight, whether it's from a 5-pound dumbbell to a 10-pound dumbbell, or a 700-pound deadlift to a 750-pound deadlift. Seeing that measurable increase motivates you to work harder. And that's one of the things that I think is so great about doing strongman stuff, because it's, we get to load this up, we get to load a movement up, and you can increase that week by week, and that keeps the patient motivated to keep working harder.
Right, like a quantitative, tangible, this is what's going on. So real quick, just in general, would you also apply that to just say like the elderly population? Maybe they're not recovering from an injury, but just for general fitness, or yeah. Say like, I kind of thought about like disabled patients. There was the young man, he deadlifted at the Arnold, he had cerebral palsy.
Yeah. Miles is a good friend of mine.
Oh, really? Okay.
He's a total smartass, which is fantastic. And but I think I I don't think anybody is going to be made weaker by getting stronger.
Yeah.
I think is the best way to put it. I have used farmers carries with 74-year-old low back patients in my clinic. And they have just as much fun as I do doing it. And I think it's so cool to see. And I think there's just something about functional strength that makes it so relatable and so easy to do, that people just enjoy it. And, I think when you can enjoy, whether it's going through an injury or just getting healthy, the easier we can make it on people, the more compliant they're going to be with programs, and the better results we're going to see. And I think that's a beautiful thing with strongman not being that well known, and us knowing how much fun it actually can be. Being able to kind of spread that and get people motivated, it just makes it so much easier by doing stuff like this.
Yeah, I think, technically there are more injuries in strongman than say powerlifting, but that's taken into you guys lifting 450 pounds over your head. But I think relative, I think it's safer. There's not as much range of motion in some movements, or if you get an elderly person, have them push a sled, they're not going to fall. They're getting activation. So last question. So what would you like to see with your knowledge in strongman and knowledge in athletic training? What would you like to see happen to get more exposure, more for the scientific studies, more exposure to the rehab setting? What would you like to see happen?
It's funny because I feel like in both of my professions, I'm fighting an uphill battle, right? Like I'm trying to teach people what strongman is and also teach them what the hell an athletic trainer is. I think the biggest thing is if people can realize, one, that, athletic trainers are healthcare providers and not just, tape jockeys, as some people like to refer to us as.
That's rude.
Yeah, it's terrible. And I think as strongman becomes more mainstream, I think, and I hope people start to see that, one, you don't have to be a 6'10" giant to be able to do strongman stuff. I think people's only image of strongman, if they know about it, is from World's Strongest Man on TV. But then when you realize you get into a gym and you can find farmer's handles that are only 20 pounds a piece, you're like, oh, okay, so everybody can do this.
Mm.
And I think as strongman gets more popular and we see how invaluable these movements are, especially in the rehab setting, I feel like they're just going to kind of be a nice marriage of the two and help each other out. So it's a really exciting time. I mean, it was actually nice to hear you say that there was about 20 research articles. Because like I said, 7 years ago there was one. So there's a nice increase right off the bat. But it takes a special type of researcher and a special type of person that wants to jump into a relatively big unknown.
Yeah, that's going, like I said, I guess through McGill, but out in Dr. Justin Keogh, Colin Wolfe, he did a couple. He's actually done two on the physiology. Yeah, but it's all going out in Australia, New Zealand, man. So
yeah, no, it's awesome. And I think we're starting to see a lot more stuff, especially in regards, like BFR training is becoming a little bit more well known, blood flow restriction in the bodybuilding world. And now it's getting better and better in the rehab world, which is awesome. And I think it's so cool. So I think we're starting to see a lot more of these new therapies become more mainstream. It's just taking time. BFR has been around for years.
Right.
Really known as like Katsu training, in Western society. And, I think it's just taking a little bit to get momentum behind it, but I think we're going to be there soon.
Oh, quick, real quick. That reminded me, your take on cold baths for strongman. I was talking to Colin Wolfe and some other guys.
I think just cold baths is meh. I think if you're looking from a pure recovery standpoint, contrast is where it's at. Doing contrast recovery, I think, is going to be the kind of the gold standard in returns of, muscle recovery and just feeling better. I personally hate cold baths. I don't like being uncomfortable and in pain. But I'll do a contrast bath, jump between the two, for 20 minutes or so. That's kind of where I just stand, though. I think contrast is where it's at, whether it's an acute injury or you're doing it for recovery purposes.
All right, cool. Yeah, just throw that out there because that's kind of that's a bunch of studies. There's a Dr. Schoenfeld. He did a meta on that. There's no effect, but it's like for muscle hypertrophy. It can actually cause a detriment, but that's different from recovery. Anyways, cool, man. Thanks a lot, man. Good talking to you. Gotta get going.
Yeah, thanks you.
Yeah, dude. We'll catch up again.
All right, sounds good, man. Have a good one.